Hello, my name is Alice Sylvia, and today I want to share very important information with you about breast cancer. So today I am taking you to Mpisha Hospital to meet a breast surgeon doctor who will give you more details on breast cancer, what you need to do, what you need to know, if you're suffering from breast cancer, what you can do, treatment available. I will be sharing with you all the insights that you need about breast cancer today. So join me, we go and meet breast cancer surgeon for more details. Today we are having a breast surgeon doctor who will give you more information on breast cancer. He will be telling you all you need to know, all the information basically you need to know about breast cancer. So welcome doctor on board.
My name is Marek Ostrowski. I'm a consultant breast surgeon at Mpisha Hospital in Nairobi. For the last 15 years I've been dealing mostly with breast problems, but I also deal with skin cancers, and I work together with a multidisciplinary team at Cancer Care Kenya to help my colleagues dealing with other cancers as well. Breast cancer happens everywhere. Breast cancer happens in Europe, in America. It does happen in Africa. It does happen here in Kenya. The statistics say that 1 in 8 in Europe or America, officially 1 in 10 ladies here will develop breast cancer. What we see here in Kenya is that up to 30-40% of breast cancer patients are very young girls in their 30s and 40s. We do not understand why, but this is the statistics, this is what we see. The problem which we have in Kenya is that 8 out of 10, 80% of patients with breast cancer come very late. They come when the disease is already stage 4, when it's spread, and when it's very difficult to deal with. We can keep it under control, sometimes even for many years, but at that stage it's very difficult to cure it completely. Yes, there are two biggest killers of ladies, of women here in Kenya, in East Africa. It's breast and cervical cancer. The truth is that in Europe and in America, women do not die because of these cancers anymore. We have screening programs, and we have the screening programs working really well for many years. And if cancer, and it's both breast and cervical cancer, if the cancers are caught early, very often we can even catch precancerous cells. So a bit of surgery is enough to deal with the problem completely. Yes, cancer can be cured if caught early, and early detection saves lives. I think the problem is the awareness. We meaning we, because it may happen to men as well. Yes. It's not a common cancer, but breast cancer does happen to men. We don't think it will happen to me. That's why, very important, and we meaning here in Kenya, we have screening program, and the guidelines say that for breast cancer, screening should start at the age of 40 with mammograms, once every year up to the age of 54, and then once every 2 years later. If there is any family history, breast, ovarian, prostate, or some other cancers, sometimes we start screening earlier, the mammograms at the age of 35. We also have other means of checking, screening. It could be an ultrasound scan, sometimes an MRI. Yes, screening is available in Kenya, but we don't use it enough.
How many types of breast cancer do we have?
It's a very good question, because usually when we talk about breast cancer, everybody thinks, oh, one breast cancer. The truth is that there are at least 10 different types. And we can talk about 10 different types from different perspectives. Histopathology colleagues, my colleagues in the lab, they talk about ductal carcinoma, lobular carcinoma, and some other carcinomas. These days we talk about breast cancer in a slightly different way. We know or let's say we divide cancers into cancers which feed off estrogen or they don't feed off estrogen. Some cancers are HER2 positive, some are not. So then when you look at it, we can have triple positive cancers, triple negative cancers, which are treated in a different way, and the survival could be slightly different. So yes, just to summarize, there are at least 10 different types. Everybody's different and every cancer is different. So that's why it's very difficult to say, oh, a colleague of mine had a cancer and this and that happened, and another one had something else and it didn't happen. Because two different people, two different cancers. Still, most of those cancers can be cured completely if diagnosed early. Yes, here in Kenya we have a few major hospitals, private and public, and we can do all the scans, we can offer all the histopathology apart from one little test which needs to be sent outside. But otherwise, most of the tests are offered here, both in public and in private sector. Yes, we have a few cancer centers in Nairobi, and it's very easy. You can Google it and you'll find at least 5 of them. You ask me about different types of cancer. Yes. And depending on the cancer, we can offer different types of treatment to different types of cancer. So, for example, sometimes, or let's say, I'm a surgeon, so of course I have to tell you that surgery is very important, and it is true. It doesn't mean that we need to start with surgery. Sometimes with different patients, different cancers, we may need to start with some other treatment, for example, chemotherapy, and then surgery happens later. But yes, indeed, surgery is a very important part of treating any cancer. But very often we may need some help from oncology colleagues, and it means chemotherapy, it means radiotherapy, it means endocrine treatment, sometimes it means immunotreatment, which is Herceptin, trastuzumab. So yes, there are many different ways, or let's say treatment options, and all of them are available here in Kenya. For many years, we surgeons, we population, we used to think that breast cancer, the best way to treat breast cancer was mastectomy, surgery to amputate, to remove the breast. Yes. We are aware, we have proof that the early mastectomies were done even in ancient Egypt and India, so it's a couple of thousands of years. The modern mastectomy was created by a surgeon called Halstead in America in 1890s, and for many years this was the mastectomy has been improved and modified, but since 1960s we've been using something called modified radical mastectomy. And we, especially we surgeons and the public, we used to believe that this is the best way to treat cancer. Not anymore. Not anymore. Fortunately, yes, we can preserve the breast, we can offer breast conserving treatment, and for example in Europe, 75 to 80% of breast cancer patients have breast conserving treatment, which means lumpectomy plus radiotherapy. It's a package. It's breast surgery with radiotherapy together. There are a few examples of cancer when it's not safe to offer breast conservation, but there are very few indeed.
Kindly expound more on cancer stages.
Very often we confuse grading and staging, because when we talk about cancers, there is that grade, and for example with breast cancer we have grade 1, 2 and 3. So this is an information which I get, or the team gets, the clinical team gets from our histopathology colleagues, saying, oh, grade 1, this cancer is growing slowly, grade 2 growing a bit faster, grade 3 growing even a bit more faster. So this is grading, but there is also staging. Staging means at what point in the cancer history we are at the diagnosis. So stage 1 means small cancer up to the size of 2 centimeters in the breast. Stage 2 is cancer which is bigger than 2 centimeters up to 5 centimeters, the cancerous lump in the breast, yes. Stage 3 begins when it's spread to the lymph nodes, because breast cancer usually, if it spreads to the lymph nodes in the armpit first. And then stage 4 is that metastatic cancer. Then it means that it's spread from the breast, it spreads to the lymph nodes and to other organs. So this is the stage 4. This is the one which is most difficult to treat. It all depends on the type of the cancer, but most important message is that we can cure cancers even up to the stage 3. We can cure it because we work as a team always. So there is oncologist, there is radiologist, there is histopathologist, surgeon of course involved in the team, and the team, which is called tumor board or multidisciplinary team, we always discuss every single case, every single patient, just to make sure that we offer the best treatment, the best cure, to make sure that we cure it, or let's say deal with it as long as possible. It's not that easy to answer. Cancers happen, and cancers have been happening for thousands of years. That's why I mentioned that even a few thousand years ago in Egypt, they were removing the breast for cancers. Now, why some cancers happen? We can prove that about 10% of breast cancer, for example, runs in the family. So 1 in 10 is related to family history, is related to some gene mutations. But 9 out of 10, we don't know. And there are, of course, like with any other cancers, there are possibly many causes. It could be that these days we are less active. It could be that it's very possible, and probably this is one of the main reasons, is that we live much longer than our grandparents used to live. So the tissue, the abnormal tissue has time to start growing. I need to tell you a story. Every one of us today has a few cancer cells. It's normal. Every being, animal, human, will have a few cancer cells. Fortunately for us, there is a special system, our bodies have special system, and it's called apoptosis. It's called programmed cell death. So the abnormal mutated cells, they receive red light. You can imagine, just like a traffic light. Red light, stop, you are abnormal, you are mutated, you have to die. And fortunately for all of us, this happens every day and it's fine. For some reason which we don't understand, and it's quite complicated because there are many pathways, this red light, or let's say the cancer cells, skip the red light. You see it on the streets of Nairobi sometimes, people just skip the red light. And the reasons are many, and one day hopefully we'll be able to understand how to stop those abnormal cells from skipping the red light. But this is when the 1, 2, 3 cells, they keep growing, they build a tumor, they start spreading to other organs, and this is invasive carcinoma.
How many treatment options do we have, or rather how many treatment options do patients have?
There are at least 4 or 5 different options. Very often we have to mix these options and offer a few of those options together to patients. And when we were talking about different types of cancer, for example, some cancers feed off estrogen. And then these cancers which feed off estrogen, we offer for those patients, or let's say to keep them under control or to cure those cancers, we offer endocrine treatment. Some cancers require chemotherapy. Some cancers require some other treatment like trastuzumab. Trastuzumab always comes with chemotherapy. Surgery is very important. Radiotherapy is very important. So that's why every single case is always discussed at the MDT, and the multidisciplinary team recommends for this case, for this patient, we need to offer surgery, radiotherapy, chemotherapy, trastuzumab, and endocrine treatment. But at the same time, another patient with a slightly different cancer may skip the trastuzumab, maybe doesn't need chemotherapy. So indeed, yes, every cancer is different and every case is different, and that's why it's so important to have all the puzzles together, all the questions and answers, so we can offer the best treatment, recommend the best treatment.
Is it advisable for a patient to change doctors Is it okay if a patient is diagnosed by one doctor to seek a second opinion, or you can advise for a patient to just stay consistent with one doctor throughout the treatment?
Cancer is a family problem. It's not one-man show. So it's not only the person who's diagnosed, it's the person who suffers. It's the family who suffers. It's the partner, it's the kids, it's very often the sisters, brothers, parents. So the family, of course, is the patient who's most important, but together with the family, they have to feel comfortable with their doctor. I would recommend, what you should ask your doctor is, do you work as a team? Do you discuss the cases with the multidisciplinary team? Because it's very important. That's why I'm stressing it so much. Because, for example, if someone comes to me and says, look, I would like to get a second opinion before we start treatment, yes, of course, it's very important, because although I work together with the team, and whatever I recommend is not me, Marek Ostrowski, it's the Cancer Care Kenya multidisciplinary team. We work together, we get together once a week, we discuss every single cancer patient. But at the same time, it is very important sometimes to go and see another doctor just to see, okay, will they offer something similar? Will they offer something completely different? It's very important to make sure that the doctor understands, has all the answers. And before we start talking about any treatment, we have to make sure that we have the imaging, we have to have the mammogram, we have to have the ultrasound scan, we have to have the biopsy, we have to have the histopathology. Histopathology, it's not only cancer, no cancer. Before we start treatment, we have to understand what is the type of cancer, which you asked me the question. Is it feeding off estrogen? Is it HER2 positive? Will it respond to this treatment or the other treatment? So yes, it's very important that your doctor works as a team, and I believe that every one of us has the right to second opinion. And of course, if someone and very, very important is, you have to be comfortable with the doctor who's treating you, because it's a teamwork, and the cancer patient and the family becomes part of the team. And it's very important. Cancer treatment doesn't take a day, month. It takes 5, even 10 years, because it's the initial treatment. It could be surgery, then recovery after surgery, then it could be a few months of chemotherapy, there could be a month of radiotherapy. There is a follow-up process which takes at least 5 years, depending on the type and on the age of the patient. So that's why once you stick to your doctor, it's for many, many years. Yes, of course. It's part of the treatment and it's part of the follow-up. Standard. So that's why it's so important to work as a team, because what happens is, yes, of course, we have to have the diagnostic team. So it's my radiology colleagues, it's my histopathology colleagues. Yes, of course, it's very important to have the clinical team, the team which recommends the treatment. Yes, someone, and I did mention it, that very often it's the surgery, which is also very important, but surgeon, I need my other colleagues to make sure that we offer the best treatment, and that we make sure that the patient is happy with the treatment many years later. Yes, the surgery, talking about surgery, we did talk about mastectomy versus breast conservation. Yes, now we have ways of, even if cancer initially is slightly bigger, let's say the stage 2 or stage 3 cancer, if it's slightly bigger, we have ways, for example, chemotherapy, we can shrink this cancer, the tumor, the lump, and still remove the lump, not the breast. Okay, and now at MPSHA we have new, for last few months, we have a new equipment, new toy, which I'm really excited about, because this allows me to offer this treatment. For example, we can shrink the tumor, we can mark that tumor, mark that lump, and remove it a few months later, or let's say remove this area a few months later. And it's very important, because some cancers will disappear completely, but I still need to remove this area to be safe. I can clip the tumor, I can clip a lymph node. So then again, after chemotherapy, we can make sure that we remove the area of previous cancer and lymph node which was previously involved in cancer. Treatment failing. In medicine, never say never. It's very rare.
Yeah.
But I've seen thousands of breast cancer patients. I've been dealing with breast cancer for the last 15 years, and I used to work in a very, very busy breast unit in the UK. We saw 1,000 patients every year, new patients. And I remember 1 or 2 patients where the treatment failed.
Yeah.
And why did it fail? Was it very aggressive cancer? There usually, like in those cases, there were a few things put together. Yes, but so it's very, very rare. And you see, the beauty is that working as a team, if we try one treatment and it doesn't work, we try the other treatment. So for example, if we start chemotherapy and chemotherapy doesn't work, then I do the surgery. So there is always something else we can do. But for treatment to fail, I remember one patient over the last 15 years. Never say never, but it's very rare.
Doctor, what can you tell our viewers out there in regards to this being the month of breast cancer awareness?
Message to take home. Breast cancer happens. It will happen to 1 in 8, officially, according to official statistics, 1 in 10 ladies here in Kenya. It is very important to know, and this is message number 2 to take home, we can cure it completely. And the treatment doesn't have to be very expensive. It actually can be very cheap if cancer is caught early. There is a screening program, and it's available in Kenya. It's available in public hospitals. It's available in private hospitals. And if cancer is caught very early, sometimes it's a tiny bit of surgery which can cure it completely. Then, of course, we'll follow that particular patient with mammograms, or we'll follow the patient with some other scans for 5 years, 10 years, depending on the age. It's Breast Cancer Awareness Month. It is very important to be breast aware. The screening exists. Screening is here for all of us, and early detection saves life, saves many, many lives.
So you've heard it from the doctor. When it comes to breast cancer awareness, you need to make a point to go for tests. Early tests for breast cancer saves lives. As you've heard the doctor say, it is curable, so you don't have to be worried. MP-Share, they have great offers this month. Be checked, because it's for your own good. So it's important to just come and get tested, and it's important to do it often. Don't say that you've had breast cancer checked maybe a year or 2 years ago and that's it. You need to keep on doing the tests. As the doctor said, 1 in every 10 women, they are suffering from breast cancer. Thank you so much for watching up to this far. We appreciate it, and keep it here until next episode.